So hello guys, today I'm going to discuss about meningitis. I'm going to give you guys some brief information about it. So first, let's define cranial meninges. This cranial meninges is the one that forming the immediate protection or the protective covering of the brain and the spinal cord. So cranial meninges has three layers. So first we have the dura mater. Dura mater is the first layer or the outer layer. We have arachnoid matter or the middle layer, and we have the pia mater, which is the inner layer or the last layer. And then we have this thing called subarachnoid space. This is between arachnoid and pia mater, where the CSF or the cerebrospinal fluid circulates. And this cerebrospinal fluid is a clear, colorless liquid that protects the brain and spinal cord from physical and chemical injuries. It also carries oxygen, glucose, and other needed chemicals from the blood to the neurons. And the spinal cord is the one that controlling our body movement. It regulates visceral function, processes sensory information from extremities, trunk, and many internal organs, transmitting information to and from the brain. So now let's define meningitis. So meningitis is the inflammation of the arachnoid in the pia mater of the brain and the spinal and the CSF or the cerebrospinal fluid. So the organism is the one that is responsible for meningitis. The organism enters the CNS via bloodstream and blood-brain barrier. And the invading microorganism migrate throughout the CNS via the arachnoid space where the CSF is circulating. And the presence of microorganism in the subarachnoid space, it is the one who is responsible for the inflammatory response. And the exudate formed by these may spread to both cranial and spinal nerves, causing further neurologic deterioration. So we have two types or two kind of meningitis. We have viral and bacterial meningitis. So first, let's define viral meningitis. So viral meningitis is the most common type, or it is also known as aseptic meningitis. It is often occurs as a sequela to a variety of viral illnesses such as mumps, measles, herpes simplex, and herpes zoster. Viral meningitis is the formation of exudate. It does not occur and no organism are obtained from the CSF. So basically, it doesn't contain any organisms. And the inflammation occurs in the cerebral cortex, white matter, and meninges. So like the whole meninges. And then bacterial bacterial meningitis. So bacterial meningitis is the most common form of meningitis. It is a medical emergency with a mortality rate of 25%. The infection can cause tissue around the brain to swell. This interferes with the flow and can result to paralysis and even stroke. So at risk are the vulnerable population. So let's compare the cerebral fluid findings and bacterial and viral meningitis. First, we have the appearance. So from bacterial meningitis, the appearance is cloudy and turbid, but in viral, it's clear. And the WBC in bacterial and viral meningitis is the same. They're increasing. And for protein, it's also the same. It's increased also, and for viral, it's increased or slightly long. And then for glucose, for bacterial meningitis is decreased. And for for bacterial meningitis, it's decreased. And for viral meningitis, it's normal. For the CSF pressure, for bacterial meningitis, it's elevated. And for viral meningitis, it depends or it varies. So now we're gonna discuss about signs and symptoms. So this is the most common symptoms when you have meningitis. First, we have headache, nausea, vomiting, fever, photophobia, and seizure activity. These are just the common, so we're not gonna discuss further. So then we have now the diagnostic tests. First, we have CT scan or MRI. This is to identify if the patient is experiencing ICP or the intracranial pressure. And then we have the lumbar puncture test analysis. This is for CSF. And then we have X-ray of the chest, air sinuses, and mastoids. This is to determine presence of infection. And we have the CBC and WBC count. So, treatment. Let's go to treatment. So, first we have broad-spectrum antibiotics, Staphylococcus vancomycin, cetazidime, and many more. It depends on whatever. So, last, we have the nursing intervention. So, first we have to assess for the neurologic status, of course, and then you have to take the vital signs every now and then. It's every 2 to 4 hours. Then we have to do cranial nerve assessment. We have to record the intake and output of the patient. We have to also decrease the environmental stimuli of the patient. And we have to monitor and prevent complications like ICP, fluid and electrolyte imbalance, seizure and shock. So that's basically it. So yeah.